Hello, everyone. Good evening. My name is Mr. Alan Matus, and I am your nurse educator for tonight. Welcome to our Facebook Live on nursing prioritization and delegation. So for tonight, we have prepared your questions again. Okay, that would be delegation prioritization, and then also again for tonight, we will be announcing the winner for last week's um, 90-day free online NCLEX review. Everybody, okay? So keep posted, everybody. Will announce that at the end of the session. Yes, thank you very much, everyone. Yes, am I saying that? Yes. Okay, so we always check the audio before we start this session, everyone. Okay, but anyway, also another thing that I would like to announce, it's Thanksgiving this month, right? So wait for our special discounts and promos regarding our online NCLEX Academy. So before anything else, without further ado, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I'm a nurse educator for almost 25 years, and I have been helping students pass the NCLEX examination. Okay, and also currently I am a nursing faculty, and also I am a an author. So I published a book in Amazon that would be the simple, fast, and easy NCLEX review. Okay, and of course I'm also the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Okay, so everybody, let's have okay our what's this? Our agenda for tonight, everybody. Okay, so I hope everybody can hear me still. Okay, let me see. So that is my book in Amazon, everyone. Okay, so that's available also in the Philippines, and if you want to order in the Philippines, you can go to Matus Nursing Review. You can email Matus Nursing Review academy@gmail.com. Okay, so that's the email, and then also you can go to Amazon to order the book as well. Okay, all right. So so we have yes, Jenny Ramos said very good, like a lot. So she likes the book. So thank you very much for that, Jenny. Okay. All right. Now let's have the next agenda for tonight. Okay. So of course, as usual, we have the motivational photo of the week. So we have the this photo is just our workbook. We posted this workbook this week, and the good thing about this workbook is that we're shipping this to Saudi Arabia, actually. Okay, so the book is great. I use it for content and pass my NCLEX. Wow, thank you very much, Veronica, for appreciating my book. All right. Okay, so very, very much happy to be here again. All right, so we have a lot of comments going on, everyone. Okay, so this book is being sent to Saudi Arabia, everyone. Okay, it's going to Julie. So Julie, hopefully you like our workbook. Okay, all right. Of course, we also have our testimonial. And just this morning when I woke up, I received this email from Giselle. Okay, and it's really inspiring and a very great morning because I received this email, and she told me that this dear Mr. Matus, okay, she said, I passed my NCLEX-RN on November 12th. I want to thank you for your amazing review. I will continue to recommend your product. You're an awesome educator. I can't thank you enough. I finished in 75 questions. Okay, so Giselle passed in 75 questions, and that means that she did very well in the NCLEX examination for the RN. So again, congratulations, Giselle, for passing your NCLEX RN. Okay, very good. So that's our motivational story, okay, for tonight also. And of course, something that I would like to announce to everyone, okay, that would be our Thanksgiving Day and Black Friday sale. So we have 50% off again for the Self-Study Comprehensive Online NCLEX Review course. Okay, and of course, that's for the 1-year unlimited online access NCLEX review. So if you're reviewing online, you will receive 50% off self-study comprehensive online NCLEX review course. So instead of $499 for the whole year, it's going to be only $249.50, and this sale is going only starting only from November 26, 27, and then 28. So 28 is going to be Monday. All right, so Cyber Monday. So it ends November 28, 2020 at 12 midnight Pacific Standard Time. So take note of the dates, everyone. If you know any friends who would like to benefit from the program and get a very good sale, all right, so you can purchase this this upcoming Black Friday and also Thanksgiving Day sale, everybody. Okay, it only applies to the 1-year review, not to the other review courses. Okay, all right. So now we also have for tonight, okay, we have the free 90-day online NCLEX review. Okay, so whoever joins this program tonight is going to be entered into our list who will probably win the 90-day online NCLEX. Okay, so all right, so we have some questions. Any sale for the workbook? Yes, a very good question. We actually will have a sale, you know, in terms of the workbook. The workbook that we have for the review, the one that you can see there, the workbook is normally $94.50. So probably it's going to go down maybe $70 or $60. So wait for announcement in our Facebook page and also in our email list as well. So the workbook will also be in sale, definitely, and it's only for a limited supply, everyone. So you better order once the sale goes on. You better order right away because the supply runs out immediately. Okay, so all right. Okay, and of course, one request to everyone: if you can, please share this Facebook Live, okay, in your timelines, and also if you're watching in YouTube, please don't forget to click subscribe. Okay, so thank you very much, everybody. So let others benefit also from the program. Okay, so without further ado, let's proceed now to our first question for the night. Okay, so our first question for the night is going to be a prioritization question, everybody. So are you ready, everyone? Okay, so we'll have our first question, everybody. Okay, so let's have the question now. Okay, so prioritization question will be about laboratory results. Okay, labs. So the nurse reviews the laboratory results of the following clients. Which client needs priority attention? A, the 34-year-old client with elevated amylase and lipase due to acute pancreatitis. B, the 60-year-old client with atrial fibrillation who has an INR of 3 during warfarin dosing. C, the 45-year-old client who has leg tenderness and elevated D-dimer after a hip fracture repair. Or D, the 25-year-old client admitted for myocardial infarction who has elevated troponin levels. So again, this is a priority question, everyone. You need to find out which patient is going to be the most unstable or the patient who needs immediate attention because there is an ongoing problem or a complication that we need to address immediately. Okay? All right. The nurse reviews the laboratory results of the following clients. Which client needs priority attention? Okay, A, the 35-year-old client with elevated amylase and lipase due to acute pancreatitis. B, the 60-year-old client with atrial fibrillation who has an INR of 3 during warfarin dosing. C, the 45-year-old client who has leg tenderness and elevated D-dimer after hip fracture repair. Or D, the 25-year-old client admitted for myocardial infarction who has elevated troponin levels. So can you please state the rationale for your answer, everyone? If you answered C, if you answered D, please let us know why is C or D your answer, or A is your answer, or B. So you have to support your answer, everybody. Now, I'll give you one tip in answering this question. Always remember that if the manifestations or the symptoms are part of the disorder, then it may not be a priority. Okay, if it's an indication that it's part of this the condition, especially the signs and symptoms. Like I will tell you, for example, if you have renal failure, what are the signs of renal failure? Okay, so which one do you need to provide attention immediately if you're the nurse? Okay, you're checking the labs of all of these patients. Okay, you're checking the labs of all of these patients. So which one, okay, requires immediate attention? Okay, you're checking all the labs. So which one will alert you that something is wrong with your patient? Okay, you're reviewing all the labs. You're looking at the history. You're looking at the condition of your patient. But which one, which lab, when you find out, you will say, it doesn't make sense. Why is this happening? Okay, so the answer is going to be letter what? Okay, okay, all right. So which one do you think needs attention? Okay, so we have different answers for everyone, but we have one person here who gave a very good rationale. Let's see. Okay, so let's see. All right, so let's have the answer, everyone. We have a battle of the answers. It's either C or D, right? A lot of people are answering C. Some people are answering D. So we will try to find out what's going to be the answer, everyone. Okay, so so we have a lot of rationalization happening in the comment section, and that is good. Okay, because we want to make sure that you are also using your critical thinking and analyzing the question. But always remember, okay, don't choose an item just because it sounds serious or it has nice words or you're familiar with it. You really have to look at the condition of your patient. Okay, so the answer is going to be, all right, you will be surprised of the answer, everyone. Okay, the answer is going to be letter C, everybody. Okay, so letter C is the answer. Now, why is letter C the answer? So priority attention, you have to remember that letter A, elevated amylase and lipase, is expected in acute pancreatitis. Okay, so the fact that your patient is having acute pancreatitis, then your lipase and amylase definitely will be elevated. You don't need to call the doctor or the physician and say the amylase and lipase are elevated, because those are those are the diagnostic tests actually for acute pancreatitis. Your letter B, okay, your letter B, the 60-year-old client with atrial fibrillation. We all know that atrial fibrillation can be serious. However, you have to look at your INR. Your INR is 3. So 3 during warfarin dosing is acceptable, because your normal INR, when the patient is taking warfarin, is going to be 2 to 3. So 3 is expected. So we eliminate A and B. Now letter D. Okay, you have myocardial infarction. We all know that this patient has been admitted for myocardial infarction. And what is your diagnostic test for myocardial infarction? The number one confirmative test is going to be elevated troponin levels. So it's part of the lab. You expect that as a result of the lab for someone with myocardial infarction, right? So the answer here is going to be letter C, everyone. Why? Because you have someone with leg tenderness, which is a sign of deep vein thrombosis or thrombophlebitis, and the fact that you have elevated D-dimer after a hip fracture repair. Always remember that patients who have hip fracture and who has a hip repair, for example, the number one risk that you have is thromboembolism. A lot of these patients are being placed on IV or intravenous heparin because we have to prevent blood clots, right? So letter C indicates that a complication is present. You have an elevated D-dimer, which is not expected. If you don't know, everyone, I teach this in the online academy. Your D-dimer is a blood test to find out if a clot is present in the body. Okay, and also the fact that you have leg tenderness, that can also be a problem. So that's why letter C is the answer, everyone. So Who got the correct answer, everybody? So we have people who answered C, people who answered letter D. So Amber Liu actually is correct. Very good. Okay, so for Amber Liu, she said if this is elevated, the patient may be having a thrombose formation. Okay, I know that you answered probably letter D because you're thinking of myocardial infarction. However, in this situation, everyone, letter C is the answer. Okay, so be very careful next time. Okay, so know your concepts again and really analyze the question properly. All right, so I hope you learned something for this question. Always remember, if it's part of the manifestation, then of course it may not be a priority. What if, for example, letter D, the patient has elevated troponin, however there is no diagnosis of myocardial infarction? Then maybe D is a priority. Once you have elevated troponin and it was ordered for a patient, and now it indicates the presence of MI. However, letter D admitted for MI already. The patient is already having myocardial infarction. The fact that he was diagnosed, it's probably because definitely you have elevated troponin levels. Okay, so you don't run to the physician and say, hey, we have an MI patient and we have elevated troponin. The physician will be looking at you and, like, oh yeah, okay, that's the reason why I diagnosed the patient as having myocardial infarction, because the troponin is high. Am I right? For letter D, for example, you have myocardial infarction patient. What if we put there a 25-year-old client with myocardial infarction with jugular vein distension? Then, there you go, we have a problem. Because you know why? Jugular vein distension is not part of myocardial infarction. Did you get me, everyone? So it can probably indicate that your myocardial infarction patient is developing acute heart failure, which could be a complication of myocardial infarction. Okay, so see how the situation changes. Okay, and always go back to your airway, breathing, and circulation. Do you see any airway problem in this situation? No, there's no airway situation. There's no breathing problem in this situation. So you could go with letter C, everyone. Okay, all right. Okay, so, all right, so we now go to the next one. Okay, another prioritization question, everyone. Okay, so I hope that you learned something from that. Okay, so let's go to number 2. All right. The nurse is making rounds at the start of the shift. Which of the following clients need to be seen first? A, the 23-year-old client who complains of blurred vision and nausea due to a migraine attack. B, the 36-year-old client with diabetes mellitus who has a blood sugar of 290 milligrams per deciliter and fruity odor on breath. C, the 55-year-old client who reports dysuria and orange urine after taking phenoxyparidine. D, the 66-year-old client with liver cirrhosis who has jaundice, distended abdominal veins, and ascites. Okay, so let's repeat. The nurse is making rounds at the start of the shift. Which of the following clients needs to be seen first? Okay, A, the 23-year-old client who complains of blurred vision and nausea due to a migraine headache. B, the 36-year-old client with diabetes mellitus who has a blood sugar up to 90 milligrams per deciliter and fruity odor on the breath. Letter C, the 55-year-old client who reports dysuria and orange urine after taking phenoxyparidine. And letter D, the 66-year-old client with liver cirrhosis who has jaundice, distended abdominal veins, and ascites. Okay. So write your rationale, everyone, and the reason for your answer. Okay? All right, so some people are still giving their answers, everyone, and I hope this question is a little bit easier, I guess, than the first one. But hopefully this will be the question in your NCLEX, right? And you will really get the right answer. I'm very confident of that, everybody. So which patient, okay, is going to be your priority first? All right, so which patient? Okay, A, B, C, or D. Okay. All right. So you have the question, everybody. I think that we have people answering differently again. Okay. So some of you are answering letter A, some of you are answering letter B, some are letter C. Hopefully, letter C, I'm not really very sure of that, guys, too. Okay. But let's go ahead and get the answer, guys. Okay. So the answer to this question, everyone, is going to be letter B. All right. So let's see who got the right answer. So Hassan Dolma Lama got the right answer. Because the client is developing diabetic ketoacidosis because of fruity odor on smell and a high glucose level. That's correct. Okay. So this patient is having diabetes, your letter B. However, the fact that you have a blood sugar of 290 and a fruity odor on breath, that's really very high. And then that indicates the presence of a complication known as diabetic ketoacidosis. And we all know that diabetic ketoacidosis is a serious condition, right? So B is a priority. We all know that in diabetes, your blood sugar will be high. However, this indicates the presence of a complication. So there you go. Always look at the clinical description. Okay. Now, A is not the priority because it's blurred vision and nausea, which are part of the symptoms of migraine. A can be a priority because it is pain, but if you have to compare A and B, B comes first before your letter A. So you have to address letter B first because B is more life-threatening compared to your letter A. All right, because migraine, migraine, it's not a head injury wherein you have an increased ICP for letter A. No, letter A is migraine. And in migraine, you have blurred vision and nausea. And you have to give pain medication for that. Okay? Don't imagine something else that there's increased ICP going on. There is no head injury in letter A. Okay? So that's why the answer is going to be letter B. Now, letter C is not the priority because you know why? Phenazopyridine, you have to go back to your medication first. Phenazopyridine, or a brand name for that is Pyridium. That is a urinary analgesic that is being given for patients who have urinary tract infection, and a side effect of that is orange colored urine. Now, why is C not the answer? Because letter C, you have to remember that dysuria is part of the manifestation of of urinary tract infection. So it may not really be a priority, okay? Because the fact that you're giving phenazopyridine, which is a urinary analgesic, to reduce the pain in those having urinary tract infection. So C is not the answer, everyone, okay? Now, letter D, someone with liver cirrhosis who has jaundice, distended abdominal veins, and ascites, those are expected. Those are expected, your letter D. So remember that again, everyone. Hopefully you learned something from this question. Okay. All right. Letter B is the answer because we all know letter B, it's a complication. All right. So remember that. Okay. Anything that is not part of the symptom, it may indicate the presence of complication or a worsening condition. Okay. Letter C, you have dysuria. Well, that's the reason why you're giving phenazopyridine, right? So please Google and research your pyridium, everyone. Okay. All right. So I hope you got this right. Always remember, priority is always airway, breathing, circulation. Okay. Pain is a priority. Safety is a priority. Infection, okay, is a priority also, or risk for infection. Remember that. Now, if I put in the situation, let's say letter D, the client with liver cirrhosis who is having severe shortness of breath and a pulse ox of 80%. Do you think letter D will be the best answer if I change letter D? Okay, 66-year-old client with liver cirrhosis who has severe shortness of breath or a pulse ox of 80%, then D becomes the priority because that is your airway. Did you get me, everyone? Airway. Then you can probably have letter B, and then the last is letter A. So remember that, everybody, that situations can change. Okay? So remember that example that I just give you, and I really want you to rewind and listen to what I just said. Okay? So hopefully you're learning, everyone. So Emma said she's learning, definitely, because a bulk of questions in your NCLEX will be on prioritization, everyone. okay, and delegation as well. So that's why we specialize on this topic every week. Okay, so let's get away from that question. I hope you learned something. Now let's go to your delegation question, everyone. All right. The registered nurse assigns tasks to the unlicensed assisted personnel or UAP and licensed practical nurse while caring for a client who is recovering from a stroke. Which of the following tasks can be delegated to the UAP? Select all that apply. A. Elevate the arm on a pillow. B. Assist the client with leg exercises. C. Place the collar within reach. D. Check nasogastric tube patency. E. Perform tracheostomy care. F. Measure intake and output. And D and G. Do your mouth care. Again, I will read the question. The registered nurse or RN assigns tasks to the unlicensed assisted personnel or UAP and licensed practical nurse or LPN while caring for a client who is recovering from a stroke. Which of the following tasks can be delegated to the UAP? Select all that apply. Okay, A. Elevate arm on the pillow. B. Assist the client with leg exercises. C. Place the colite within reach. D. Check nasogastric tube patency. E. Perform tracheostomy care. F. Measure intake and output. And G. Do your mouth care. Okay, so what can the UAP do in this situation? Okay, what can the UAP do in this situation, everyone? Okay, all right, you have to be very careful. You can have this kind of question in the NCLEX. Select all that apply on delegation, everyone. So be very careful with your answer. Always go back to the basic concept. You know, what are the things or the tasks that can be delegated to the UAP? So simple, routine, okay? So that would be activities of daily living, something that is simple. Okay, just think also what certified nursing assistants do. And also remember, in other states, your nursing assistants or your UAP have different responsibilities as well. But generally, what can they do? So this client is recovering from a stroke. Okay, this is not a client who is having stroke for just 24 hours ago. This is a client recovering from stroke. Okay, it could be a client who is on rehabilitation also. Okay. All right, so let's have the answer to the question, everyone. Okay, I think some of you are still putting your answers. Okay. All right, so let's see, okay, what will be the answer to the question, everyone? I think a lot of you are putting different answer. It has to be simple, routine task. So, Ma Sylvia said that simple, routine task. Very good, okay? All right, so Christelle is putting A, B, C, F, G. So we'll find out if that is correct, okay? All right. So the answer, everyone, to this question is going to be, all right, let's see if you got the right answer. Okay, so that would be your A, B, C, F, and G. Very good. So your UAP can do elevating the arm on the pillow. Very good. Assisting the client with leg exercises. You all know that passive range of motion is one of the tasks that the UAP can do. So letter B is okay. Letter C, placing the colite within reach. That is okay, of course. Letter D and E should be done by a licensed nurse. It could be the LPN or the RN. And then letter F, measuring intake and output. Definitely they can do that, measure intake and output. And letter G, they can also do mouth care. So who got that question right, everyone? Don't forget, measuring intake and output, routine intake and output could be done by your UAP, everybody. UAPs can also collect urine specimen and stool specimen. UAP can assist the client in ambulation. The UAP also can help the patient feed himself or feed the patient as well. So remember your activities of daily living, everyone. Okay? So I hope that you learned something on this question, everybody, in terms of delegation. Okay? All right. So some of you are changing your answers, and that's okay. All right? Okay. So practice makes perfect. Okay? So let's have the last question for tonight. Can I have a very big yes, in the comment section? And you can also put, from what country or state are you answering from? I would like to know, if we have international students in this Facebook Live. Okay? All right. So let's have the last question, everyone. Okay. So Jessa said, yes, I am learning right and smart. And Jessa, I would like to let you know as well that we do have other videos in YouTube, so you can watch all of our recordings or some of our recordings in YouTube. The complete set of our YouTube videos of these videos that we have are in the online academy. The complete set. Okay, so we have students, okay, from California. There's a lot from Nepal, okay, from Kingdom of Saudi Arabia, okay. Oh my gosh, it's a lot. I cannot catch up. Okay, so we have from San Jose, also California, Chantel. Okay, Philippines, Amber. Okay, okay. So let's proceed. Number 4. Which of the following clients may be assigned to the licensed practical nurse LPN while under the supervision of the registered nurse? A. The 43-year-old client with pneumonia who needs a complete head-to-toe assessment. B. The 34-year-old client who requires atropine administration due to a second-degree heart block. C. The 55-year-old client with ulcerative colitis who needs colostomy care. Or D. The 49-year-old client who needs repositioning for hours a mastectomy. Okay? All right. So again, which of the following clients may be assigned to the licensed practical nurse while under the supervision of the registered nurse? A. The 43-year-old client with pneumonia who needs a complete head-to-toe assessment. B. The 34-year-old client who requires atropine administration due to a second-degree heart block. C. The 55-year-old client with ulcerative colitis who needs colostomy care. Or D. The 49-year-old client who needs repositioning 4 hours after a mastectomy. Okay? Let's see what's your answer, everyone. Okay? Okay. So it seems like everybody has given their answers for tonight. Okay, so what will be the answer? Who is the stable patient here? The most stable that you can give to the LPN and is also within the scope of practice of the LPN as well. So make sure. All right. So the answer to this question is going to be letter. Are you ready, everyone, for the answer to this question? Okay, so the answer is going to be letter C. Very good. Okay, so C is the answer. Why? Letter C is the answer because a client with ulcerative colitis who needs colostomy care, that's a stable patient. And then, of course, colostomy care is within the responsibility of the LPN, one of the tasks. Now, letter A is not the answer because A, complete head-to-toe assessment or comprehensive assessment or admission assessment is the responsibility of the RN. Letter B, atropine administration due to a second-degree heart block. That is an unstable patient. The fact that you're giving atropine for bradycardia, right? And remember that atropine is also being given intravenously. And we all know that LPNs cannot handle or give intravenous medications. Now, letter D is not the answer because repositioning, that could be done by the LPN or the UAP can do repositioning. However, remember letter D is a fresh post-operative patient. Letter D is 4 hours after mastectomy. That's a fresh post-op. Okay, so we don't assign recent surgery or fresh post-op patients to LPNs as much as possible. So that's why for this question, letter C is going to be the answer, because obviously that is the most stable patient. Am I right? We also have to remember, as what we have said before, the RN is not supposed to delegate evaluation, assessment, and also your teaching everyone. And also, any planning, any analysis, evaluation, or any discharge teaching should not be given to the LPN. Okay, especially complete discharge teaching. Okay. All right, so very good. So we have a comment from Shrestha Shuljara. All your questions are so good. Thank you so much. Thank you very good. Thank you very much for that comment. Okay. So, oh, thank you for describing with rational. Okay, very good. All right. Then Menchi said, thank you very much again, Sir Alan, and God bless for your kindness. Yes, I'm giving away, right? Okay. So, anyway, we're about to announce our winner, but before anything else, for those who would like to know information, we're going to put the links in the comment section. Okay, so we have our Matus Nursing Review online NCLEX Academy. We do not have classroom classes at this time. We do have live webinars. We are doing 10-day live webinars on Saturday, 8 to 4 p.m. And then also the 12-week fast track on Tuesday from 6 to 9:30 p.m. So go to the website and find out about the schedules. For the 10-day webinar, we are starting again January 30 to April. So right now we have an ongoing class, and you can always also request for a sit-in if you want to observe the classes. And of course, we do have the self-study program, the self-study comprehensive online NCLEX review course as well. Okay, and everything, you have the option, okay, for everything to come with a workbook. So our monthly subscription is $49, and I really recommend that you get the workbook, everyone, because it has a high success rate. Our students love the workbook. We mail out nationally and also internationally as well. Okay, so for those who like the workbook, can you please give a shout out in the comment section, everyone? Okay, and you can see that our review program is very affordable, especially during this whole COVID situation. We want to be sensitive to our nurses who would like to do a review but then not really shell out a lot of money. Okay, all right. So who is our winner for tonight, everyone? But anyway, from Emma, she said, thanks, Sir Alan. I learned so much. Thanks for the good rationale and the explanation. Thank you, everybody. Okay, so our winner for tonight, okay, is going to be, let's see, that would be Grace Dalida. Okay, so Grace Dalida is our winner for tonight. So please congratulate her, everybody. Okay, because she is our winner. All right, so please send us an email immediately. Okay, please send us an email immediately in order to claim your prize, because we will enroll you into the program, everyone. Okay, so before we end for tonight, I'm gonna see you again next week. I think it's Thanksgiving on Thursday, I guess, so I'm gonna be seeing you guys. We will have our Facebook Live again, so thank you very much, everyone. I'm here for you, and we constantly review and evaluate our program to make sure that we improve, and also hopefully you find our program simple, fast, and easy to understand, everybody. Okay, so thank you very much, everybody, and have a good night, and I will see you next week. Thank you, everyone.